There's a lot of questions coming in about specializing. So did any of the doctors or the dentists you know end up specializing? And what does that look like in terms of finances and going through that route?
I'm also biased in terms of that specialized, not specializing. So just take it with a grain of salt. I feel like with this day and age, there's so many continuing education courses that allows dentists to learn skills almost to a specialty level. You know, whether you want to learn how to do a root canal, place implants, do all on fours, you know, full mouth rehab. A lot of these skills only specialists once could do that general dentists are doing now. So I'm kind of like I'm definitely opposed to students specializing early on because you know dentistry is already so specific. You know, how do you know that you want to specialize even more? You know, coming straight out of school, right? So I would work a few years and then make that decision. But a lot of the specialty kind of level skills you can just take as a course. So that's my take. Dr. Coco, what about you? Are you
I
any
agree.
of
I
your
agree with Dr. Bruce,
like?
especially in the beginning. It's very good to know what you like. Coming out of school, you don't know what you like. Is it root canals? Is it ortho? So getting that experience the first few years is very important. In Australia specifically, you have to have a year. Some schools need a year or two experience of general dentistry before you apply to specialize. So that was like a requirement there. In terms of Canada, it's um if you do specialize in Australia, it's not accredited in Canada. It's only the general dentistry that is. So that's something to think about as well. Some of my friends and the upper years, when they specialized, they went to the States because that's again accredited by Canada, so they can come practice after they specialize from America.